Hi, good morning, everyone. Welcome to 93rd International Weekly Meeting by CMAAO. We are live on 15th of January 2022, and we are talking about updates on COVID, Omicron, and what various countries are doing and what's happening. So it's good morning, good evening, and good late evening for a lot of people. We have about 19 to 20 associations, and we have invited members, guests from various parts of the world. We will start our update. We have a general update sessions which is going on right now. So before I can give an update, we have seen a lot of news which has recently flown in. Europe is start considering this COVID as a flu, which we have heard about in the news. In India, we have about 265 cases added last 24 hours, but there is a dip in the surge, which we will talk about in an Indian update. We have also seen a news where people traveling to England may not require COVID testing. There are some relaxation in the rules, and what we've been seeing over a period of time now. So is that end of the pandemic or not? Let's hear from our experts. So over to you, Dr. Chong. Let's take this meeting forward.
Thank you, Sarab. Perhaps I'll just invite my fellow members to start their updates on what's happening with this Omicron wave. I'm keen to hear from Dr. Pillay about what's happening in India, because we hear quite a bit of reports. Dr. Pillay, can you update us?
Yeah, thank you. We are definitely into a third wave, that too a very serious situation in India. The number of cases are multiplying very rapidly, and yesterday's number of $64,000 is a real jump from what it was. And the Omicron number comes to about 5,753. And Omicron, of course, the number need not be exactly correct, because you have to do the genomic study, very expensive, time consuming, and the number of samples among the total number may not be representative sample. But then some of the hospital-based data shows that up to 40% are Omicron, particularly from Delhi and all. So that is about the total number. The fatality rate is around 1.33%, which definitely, in spite of increase in the number, the fatality has not increased so far. It is almost staying at that. And then regarding vaccination, the age group from 15 to 18, from 1st January, we are vaccinating them, and by almost 10 days, about 42% of this population, that is 15 to 18 population, 42% has been given the first dose. That comes to about 3.14 crores of youngsters have been vaccinated. They have received the first dose. And that is where we stand. And as has already been mentioned, the statistics are the Maharashtra, Delhi, West Bengal. These three states, the peak has been tremendously high. But then yesterday's statistics show that there's a slight dip in the number in these three states. But in other states, definitely the number is increasing. Whether the dip is indicative of sloping down or it is only a transient dip, only further data in the coming weeks we'll be able to know. As of now, Omicron, the admission, although we don't have hard data on Omicron alone, but the admissions definitely has come down, whether it is Omicron or Delta. Admissions have definitely come down. On an average, we can say that 1% people needs admission, and even less need ICU admission and treatment. So it seems to be mild. By the duration of illness again is shorter. By fourth day, the antigen test becomes negative in a good number of cases, and a lot of asymptomatic cases are there. Children are definitely involved, and most of them are asymptomatic. The herd immunity, you can say, is almost, or even the vaccination plus infection number is almost 96% in India. And the restrictions, different states have different type of restriction depend upon the clusters that are present. Schools have been opened, but then if the number of children with the positive case are high, temporarily the schools are closed, and a hybrid way of teaching, partly online and partly physical, is being done. Night travel restrictions in some states are there. Sunday restrictions are there. Hotels, you can order and takeaway food is allowed, but you cannot sit there and eat. And even for functions, for marriage, 50 people, for death and all, 100 people, and for other public functions, the number has been restricted to maybe 200, like that. So the number definitely is being restricted. Strict surveillance of COVID appropriate behavior is happening. A lot of people are charged if they're not wearing a mask, if the social distancing is not maintained, and hand washing is definitely encouraged. And restriction as such, travel restrictions, everything is coming down. Night travel definitely has been restricted to some extent. Almost things are open, and areas where there are clusters, little more stringent monitoring of COVID appropriate behavior, and the above said facts are being monitored, and even their cases are registered if they are flouting these directions. So that is where we stand as far as the incidents are concerned. On the treatment side, molnupiravir, the drug authority has allowed it to be used, but even the use of this drug, it seems to be only 40% effective, and standardization of its use or including it in the protocol has not happened. But in states on their own, some of the states have added this on the protocol, but the sheet tanker of treatment, in spite of Omicron, continues to be in severe cases. Monoclonal antibodies are given 65 plus population, or if you have comorbidities, risk factors and all, then monoclonal antibodies are being given, and it seems to be very effective. And then remdesivir, in cases where the CRP is going very high and suspicion of prolonged viral infection is there, within 10 days, remdesivir is being given for 1 week. Molnupiravir, as I said, it has not been accepted as a standard antiviral drug so far all over India. And steroids and anticoagulants continues to be the sheet tanker. All those peripheral drugs, ivermectin, chloroquine, and things like that, hydrochloroquine and things like that, are not used now. None of them are used now. These major drugs are being used, and that is where we stand. Further details I can add on later on. Thank you.
Dr. Pillai,
Yeah.
can I just ask if Dr. Chong may ask some questions to Dr. Pillai?
Sure, please.
Yeah, thank you so much. Actually, because we are very much worried because Bangladesh is neighbor to India. In the last wave, actually, we are just affected like anything in the border areas mostly. So we are very concerned about India's situation there. So I have some questions to him. Can you just tell me, Dr. Pillai, first of all, I must acknowledge that you have given a very elaborate detail of this situation here. Okay. So can you just tell me, you were just telling the inadequacy of the genome sequencing. It's okay. Definitely it's recognized. So what is the percentage of this genome sequencing actually in terms of the Delta and Omicron now? Those actually just tested for genome sequencing. What is the percentage? So you can just guess from there.
Yeah, when we have the total number of corona cases, COVID cases, 2.64 lakhs. The proved Omicron cases are 5,753. So that is where we stand.
Graph also, you can explain this graph. I got this graph. I know this question was coming up from him.
Yeah.
So this graph will explain a lot of things here.
No, I was not telling that actually. Suppose this total 5,753 cases have been diagnosed as Omicron, okay. But how many genome sequencing has done so far? So that you can just tell, suppose in the USA, they are telling it's more than 90% because they are just comparing this between those two having the H gene target failure and non-H gene target failure.
Genome sequencing.
Suppose you have done 10,000. Suppose you have done 10,000 and you got 5,753. That's a mess. So what is the percentage?
5% of cases, the genome sequencing is being done, almost 5%. But then those who are coming flight, international flights and all, for almost all, genome sequencing is being done. When there are clusters, school-based or hospital-based or other ways or office-based, whatever, there again, almost all the positive cases are subjected to genome sequencing. Normally up to 5% of the samples.
But how can you explain so rapid spread? How can you explain? Delta doesn't spread. Didn't spread this way. But it is high actually. In a very short time, you are going up. So how can you explain? If you say this is only 5%, that doesn't coincide actually with this year.
Yeah, correct. Because genome sequencing, as you know, it is very expensive and takes time consuming. You get the result maybe in 4 days or 1 week. And we as clinicians know that the number definitely should be much, much higher than the official number that is being given on the basis of genome sequencing. Because genome sequencing, the labs which can do that are much less. So the number which ought to be done to have a representative data is not being done definitely. But as clinicians, we know because of the sudden surge and lack of severity and need for admission also is much less, then the number should definitely be higher. But official data, this is what we have with us.
Also,
I have second question actually regarding Molnupiravir. Molnupiravir, you are just telling that I have seen ICMR has given this year this information that it should not be used regularly in the person of having the in reproductive age, maybe male or female. And if they use, they must use the contraception. That is what they're just advising. So what is the basis of that? Because previously also we heard about it, but it wasn't established. But India is establishing that. Do you have an exact information about this mutagenicity like that?
Of course, we know that even its effectiveness is only 40% and much more toxic, and these problems are definitely there. But this is not given to every patient routinely. High-risk patients above 65 and high-risk patients, aged patients, and selective age group only is being done. It's not given to every patient. Risk factors are weighed and accordingly it is being done, but it has not become a standard protocol in India so far. And even the scientific bodies, not government one, otherwise, they are also saying that very much caution is required in giving this. So that is where we stand.
Okay. graphs I have, which I pulled out from Ministry of Health and Times of India. It was published yesterday. So this is the daily cases which are going in major cities and major states. So you can see a dip which has happened in the last 24 hours. And this is a data which shows the cases and the number of deaths. Again, there's a dip on January 14th, January 13th. So I will share this in the group. I just want to share with the group here. Okay. Dr. Nidhi, you want to add just a brief couple of lines on anything which you have noticed?
So with due respect to Dr. Pillai, in Delhi and North India, we are still continuing with ivermectin in our protocol. We prefer mefenamic acid instead of the standard dolo that has been prescribed in the national guidelines. And we are finding that nowhere are we having to give more than 3 to 5 days of treatment. It is mild, but it is COVID. So people who get it know that they have it. So it's body fatigue, loss of appetite are very common.
Okay. Dr. Nidhi and Dr. Pillai, and I think recently also somebody just pointed out for the mild cases, even the paracetamol is working. Regular paracetamol is working.
No, see, the standard treatment definitely is paracetamol or pain and fever and malaise, but then in situations where they are not responding adequately, definitely apart from NSAID, opioid analgesics, some of them definitely can be tried. This is only a standard one, but individual cases, of course, you are at liberty to, on institutional basis, you are at liberty to add on to the protocol. In Kerala and the southern states, ivermectin is not being given. Hydroxychloroquine we don't give, or any of those immune enhancing drugs, because it's all add on to the expenditure. And as already mentioned, now the duration is short. The antigen becomes negative in 7 to 10 days before the Omicron set in. And now, of course, in 7, as already mentioned, by 7 days or 3 days or 7 days, they become asymptomatic. And most of them don't need admission also. Now, stress is an OP treatment and home treatment, home isolation. And even monoclonal antibodies are now being given as a daycare sort of treatment. The outpatient itself, they are given this infusion, and they are, by evening, they are allowed to go home. And the response definitely are very good. Even in Omicron, we don't have a DEL data as to how much of the patients who received monoclonal antibodies are Omicron, because Omicron cases definitely are mild, and most of the time home isolation is what is required in them, and symptomatic treatment.
Dr. Nidhi, do you have any sort of data regarding or study report regarding the ivermectin you are using there?
So I'm only going by the general Delhi figures. I do have some data from institutions which I'm not at complete liberty to share here, but Delhi seems to be doing pretty well in terms of outcomes. And I mean, I would have to take permission from the place that I've got the data from to share it. I was specifically told it's only for personal consumption. But yes, we are finding that the decline has started in Delhi. We just have to wait the next week out to see if it doesn't rise again, because there was a bump in the curve in the last 10 days also. That bump was seen on, let me see. So that bump was seen on 9th, I think. 9th it had gone down, and then it began climbing again. But this decline has come, it had reached a peak of about 40% on the 10th. And now it has come down to 29 positivity. So this is the data which is from a representative lab. They are doing sampling across Delhi NCR. So it seems like from 40 to 29 is a significant fall, because that bump was just of 5%, the knee that we saw last. But in the next 3 days, it will be clearer if it is really a decline.
Okay. Okay, let's move forward now, if we don't have any further questions. Dr. Chong, I just want to read for Nepal. I think Dr. Prakash had to go for a meeting and he's left an update for me.
Yes.
It says, "Dear Saurabh, I have a meeting and leaving now for COVID cases has increased from 100 to 1,000 and now more than 5,000 in a week. Among this genetic sequence, 25% is Omicron. Again, we from tomorrow officially started booster dose to frontline workers, and from next week over 60 years for immunocompromised person, and the patient after 3 weeks to all citizens over 18. Now we finished 12 to 17 group of vaccination and going to start 5 to 11 group next month. Compared to the second wave, we equipped and resourced two-folds. The admitted patients are not critical and are not in ICU or ventilator and are very negligible. Just 2 or 4 dose. This is the Nepal update. Thank you." So this was an update from Dr. Prakash, and who had to just unfortunately leave for a meeting. Again, back to you, Dr. Chong. We can also cover South Africa. I think.
Let's get Dr. Kuzi and Dr. Akhtar to tell us about what's happening in South Africa.
Morning. I'll leave the stats to Dr. Akhtar. He will also give you the stats from since yesterday. Our stats will now include vaccinated versus unvaccinated people in the hospital. But I'll leave that part to Dr. Akhtar. So what I want to say is I'm sitting here and I'm listening, and I've got a total different look at this whole Omicron debacle that's currently going on. First of all, we said right from the beginning that this is a viral disease. And I'm something that I noticed is that the clinical aspects, the clinicians, I don't know how it works in other countries, but the primary healthcare doctors and the doctors working, whether it's specialists working with the patients, I don't hear their voices everywhere. I hear, sequencing, and I hear positivity rates, and I hear politicians, and I hear scientists, and I hear everyone except the people really working with patients. So I it saddens me, because if you look at the clinical picture, and I know maybe other countries doesn't see the patients anymore. I know maybe electronics have taken over medicine, which is totally is going to bite us going forward. But for me, who works with patients, who don't do electronic consultations, who do face-to-face, who physically touch the patients, I can tell you, sequencing is, you can look at the sequencing, but if you use your common sense and your clinical expertise that you have been trained for many years, you will know that this patient is Omicron. You don't need a sequence test to tell you that, because 99 in South Africa, we don't even see Delta anymore. And that's a clinical diagnosis. So you need your PCR or your rapid test to actually confirm your diagnosis, what you have already made from a clinical basis of. Then we know that these patients, as some of the doctors said here, it's a musculoskeletal, it's the fatigue, and it's the mildness of this disease that they will come and sit in front of you with. So you have to take the patient on the journey, and you have to tell the patient, this is the symptoms, you're not going to die. Even if you've got the mother of all headaches, it's going to be okay. So for us in South Africa, we do not have antibody treatment out of hospital. We have very little medication in South Africa that we can use at primary health care. So what we have seen Colchicine, yes, it's not working here because there is no, colchicine works very well if there's a tachycardia, if there's any cardiovascular symptoms. We don't see it on a clinical picture with Omicron. But what we do see is there's still the inflammatory type of infections. And we have seen that if you use your normal cortisone, and you can use mefenic acid, or you can use ibuprofen or any of those anti-inflammatories. That's actually the two most important things to try to get these patients through. I have now seen for the first time a long Omicron patient, and that is it's the same type of cough that you get with your ACE inhibitors. It is a very irritating cough, 4 weeks that this patient now have, and when she came back to me, very, very irritating. So I can tell you that's the first long COVID side effect that I have now seen, and I have now addressed it. It was on Friday, so I'll see whether she's going to get better or not. Then the nature of this virus, for me, and this is my personal opinion, it's a very, very fast spreading virus. It will infect people, but just as fast spreading it is, it's going to leave, it's going to decline. It's not something that we do. It's the nature of this virus. That's my observations of what I'm seeing. And there is actually no need to get patients into a hospital if you treat them right at primary healthcare level. But again, I think there's different protocols in different countries, and that's why there are people going to a hospital for admission. And we should go back to what is clinical medicine. We don't do that. And I really have a problem. And then on positivity rate, we should embrace the positivity rate. We should encourage people to test and give us the numbers, because it means that the higher that is, it gives us an indication that the virus is still active. It actually helps us to isolate that patient so that it doesn't infect anyone else. But instead of embracing that and looking at the positivity of the positiveness of a high positivity rate and help us guide, it seems to be used in certain countries to install fear. And we should not do that. And we should keep coming back to the basics of medicine. And we should keep governments responsible if there's not good sanitation and if there's not good ventilation. And if governments can't produce vaccines or masks for their people, we must go back to normal old medicine. I'm sorry, this is I just need to get this off my chest. Thank you.
Thank you, Dr. Kuzi. Dr. Akhtar?
I don't think he's there. I think he's...
Saurabh, can I come in for just 1 second?
Yeah, sure.
Yes, Dr. Nidhi?
So I am in complete agreement with Dr. Kodzi. I am basically an ENT surgeon, and I agree that you cannot diagnose a patient without being face-to-face with them. So my personal experiences with the 90, close to 100 people who have had COVID in the last 10 days within my hospital. I'm treating everyone. They do not need anything more than 3 to 5 days of treatment. It is usually symptomatic. None of them have got complicated. They do sometimes show inflammatory markers going up, particularly CRP, which we are following. If the CRP is not dropping with the standard treatment, we do add steroids or colchicine depending on the clinical situation. So I am in complete agreement with her that the hospitalizations and deaths have completely decoupled with this variant.
Dr. Angelique.
Jamal? Yes.
Yeah, I have a question to Dr. Angelique, actually, because it's a very, rather we can say this is praiseworthy that South Africa condition has been better, and you can just in comparison you can say, because it was just 20,000, near about 30,000 near about in the middle of the December, and now I can see that it's hovering around 5,000, 6,000. So it is good. So can you just tell us how it has declined? And number two, I have seen the statistics in South Africa compared with the USA. It is similar almost. So we are giving the impression to our people that is mild. It's not good. It's not good at all. It's not mild. It's just exhausting our resources. People are going for the oxygen, okay, but they are needing less oxygen for the less period, but it is getting, and the numbers are increasing. So the numbers are increased. So that is also worrying actually. So the message is going to the people is not correct actually. It's mild. That is why WHO also is saying the same thing. Thank you.
Thank you. If I can come in, Dr. Jamal, first of all, the definition of mildness of a disease is where you don't need any oxygen. There's no, there's a specific COVID definition for mildness for COVID. And Omicron at primary healthcare level fully complies with the definition of mildness. And severe disease is where you need oxygen, where you need to be either ventilated, where your PaO2 is less than 94%, where there are X-rays confirming infiltrates in the lung more than 50%, that's pneumonia, where the patient might need echo, any of those, ECMO. So that's the definition. So if you look at the definition, then at this stage, WHO must change the definition of mildness. But Omicron fulfills the criteria of mildness. We're not saying that you will not get severe disease, but 99% of people will get mildness of this disease, according to the definition that has been put out there by the WHO. So this is a mild disease, and you have to tell your people that.
Oh, but
so let me just finish. The reason why is you should not create fear. You should teach your people what to do if they have symptoms. You should teach your doctors what to do if they encounter that patient. And you should teach patients what to do when they have certain comorbidities and they might be in line or for getting severe disease. So that's the one thing. I'm sorry, that is the definition. Otherwise, we need to change the definition of mild versus severe disease according to the WHO own definition. So then the second thing is, there's nothing that we have done differently except to start to teach our patients in South Africa exactly on this, what I've now said to you. We have encouraged them to get tested, and we didn't scare them with high test positivity rates. Up even until yesterday, about 40,000 people nearly on a daily basis go and get tested, and you will see our positivity rate is coming down. And that is, as my own observation, this is the nature of the virus. It's a fast-spreading virus. We're telling you it's fast-spreading. You will have high numbers. But just as fast as it starts to spread, just as fast it is leaving, and I don't know where the virus is going. I don't know what the virus is doing in the background. But it's not because of all the vaccines and everything that will contribute to the decline. But that's something in the nature of the virus. That's what I can say. Thanks. I hope this makes sense.
Dr. Angelic, actually, I am not confused with mild or moderate like this. Not confused at all. I know it is this. But the thing is that actually I have seen a study report from South Africa recently published. Of course, it is not peer reviewed, but it's preprint. But I have seen another report already in our group. It is from the USA. So both of these actually I have compared, and they're telling the same thing. I don't know how you're telling this 99% is Omicron, but your study, I will just send it to you by this group. I'll send it to you. The report, just I got it in another group, that I'll send it to you so that you can just see what they are saying. Thank you.
Thank you, Dr. Jamal. I'm sorry, I can't say it's 99% because there's always 1% that will get severe disease. And why can I say that? Because I'm clinically involved with these patients physically and with my colleagues across South Africa. And this is what we are seeing.
Dr. Jamal, maybe you want to give us an update on what's happening in Bangladesh?
Thank you so much. Actually, it's nice to get the chance actually, because I have to leave actually very early. So this is Dr. Chong. Thank you so much, and everybody. Good morning. And in Bangladesh, actually, this is just rising, and we are scared actually now because it's now more than 10%. You can say that infections rate, and the hospitals are getting more patients. Maybe it is more for Delta, because I just confirmed from our people concerned that they're telling whatever the amount they are just doing the test and seeing the sequencing, it's near about 20 to 30% is Omicron here. So it is, of course, it's going up day by day, and number of deaths also are going up, but it's less than 10 per day now, the number of deaths. Regarding the vaccination, we have already done first dose. You can say we are about 60% of our target. This because target is fixed as 80% of the population, and so it is 60%. You can say, and the 40% is the second dose already they have got. And in case of booster, it is it's only 0.11% of the target group. So this is the condition of the vaccination. And regarding the treatment, we are planning to just take some alterations in our module and the guideline. We'll just sit together very soon, because the WHO also just indicated some sort of changes, and I can see some changes from in USA also. Which Dr. Pillai also was mentioning about the this monoclonal antibody, which I have seen. That's this regular monoclonal antibodies which are used in Delta, it's not effective in case of Omicron. So that has to be also seen, because Satrubimab, I think, is effective. They are claiming CDC is just so that has to be actually just rethought again. So and the other thing actually in Bangladesh, actually we have already started the restrictions in our movements, restrictions in the gathering, and the COVID protocol is going to be implemented and to be enforced. Rather, we can say it has already started, but the execution, we cannot say that 100% is executed. So I think from tomorrow, day after tomorrow, it will be more tough. The authority will be tougher actually regarding the restaurants and others. Also, same thing as it is going on in India also. So we are also going to implement that thing also. The thing is that actually we have not actually so much restricted so much, but I think it will go on. That is the thing. Thank you so much.
Thank you, Dr. Jamal. Marie from Japan, can we have an update from Japan? Marie?
Yes, thank you very much for always. Now we are experiencing a sixth wave with Omicron, and the number is incredibly high, but there are few patients who need oxygen, as the Dr. Angelique told us that. And for example, Southern Island, Okinawa is now the center of the infection, and it has the 1.5 million people in Okinawa Prefecture, and about 10,000 people are tested positive and under the observation right now. But I will say age of 79 and under requires no oxygen at all. But speaking about the elderly patient over 80 years need the oxygen, let's say 1/3 of people. So it's quite harmful for the elderly patient, especially over 80, but mild disease for the age under 79. So we are looking at them very carefully, and we are trying to not spread to the elderly patient, elderly people, especially in a nursing home. Thank you very much.
Thank you, Marie. Dr. Kazi? Dr. Kazi, do you have anything to tell us about Pakistan?
I think Dr. Kasser Sajjad is there. If he wants to say something, and then I can add on. Or if he's not ready, I can definitely give the stats.
Has to just leave. He just messaged me. He had to leave.
Okay,
for
okay.
Yeah.
Then I'll proceed. Thank you, Sarav, and thank you, Chong, for giving me this opportunity. I was closely, watching the stats from India and then listening to Angelique. I totally agree with what Angelique has said. And the fear factor, it has to be, reduced because that is being put up in the community. And we need to work on that, that the fear factor should not be raised so much. Anyway, regarding the first dose, Pakistan is doing well. About 101 million people have been vaccinated for the first dose, and the second dose, it's getting better. About 73 million have been vaccinated with the 2 doses. And the number of cases, definitely from the last week, which we had about 1,200 cases last week. Today, we had the stats of increasing number of new cases in 24 hours to 4,286. But the number of deaths still low. It's in single digit. Last week it was 6 in the last 24 hours, and today I had the stats of only 4 had died during the last 24 hours. Well, the critical care cases are 700 about, and in the last 24 hours we have only 34 new cases for the critical care. So things are quite normal, seems to be here. There are no restrictions, travel restrictions are not there. I mean, the internal traveling and all that. Schools are open, the markets and gatherings are there. And January is usually the wedding season in Pakistan. And I see a lot of, gatherings and the weddings. And despite the fact that we are all educating for wearing masks, keeping distance, hand washing, and of course, the vaccination to be boosted up. From today, our national health authorities have allowed 12 years plus to who can have the booster doses. And things are quite under control. Hospitals are not under pressure, and people are going for booster doses, and it's improving. And things seems to be quite under control at the moment in Pakistan, and we are closely monitoring what is happening around us in the region. And let's see how it goes in the coming weeks. And our National Command and Operation Center is also closely monitoring the rate, the positivity rate, which is, of course, getting very higher. I mean, it has gone up at the national level to 7%, while since I'm in Karachi, the positivity rate has reached almost to 29%. But the hospital pressure, hospital admissions, critical care admissions is not that very high. And but still, the authorities are closely monitoring it so that we can proceed accordingly. And regarding the genome sequencing and all that, the facility is not very widely used in Pakistan. And as Angelique has very rightly pointed out, that the clinical picture guides us in the type of variant that is prevalent. So the variant of concern is definitely we are looking at it. And that's all from Pakistan. Thank you, Chong, and thank you, Sarah. And thank you, everybody.
Thank you, Dr. Kazi. Ravi, do you want to update us on Malaysia?
Yeah, thank you, Dr. Chong and Saurabh. Well, Malaysia seems to be quite okay at the moment. Yesterday, they reported about 3,346 cases, but out of which 98.5% are under the 98.5% are category 1, 2, and 3. Only 1.5% are category 4, 5, which means they got respiratory problems. They needed oxygen and probably intensive care facilities. Our healthcare facilities are not pressured. The total number of deaths yesterday was 12, which has reduced tremendously. The government is now on a move to get the booster dose done, where many people are a bit hesitant. So therefore, we have only covered about 32% have had the booster dose. They have roped in all the general practitioners. They can get the general practitioners to give all this vaccination throughout the country. And so, in fact, they need people to help out with the vaccination process. As for the masking, well, it's mandatory, it's by law. So, everybody has to use a mask when they are out of their premises, when their houses. They have to wear masks in a mall, in a market, wherever they are, they have to use a mask. Social distancing, of course, is also mandatory. But sometimes if you see now, like Dr. Kazi said, now seems to be a wedding season actually here, not only among the Muslims, but among the Hindus also. So that is a bit of a concern, but we hope things get better. But the major problem that we are all worried about is the Lunar New Year for the Chinese, which is coming up in 2 weeks' time. Now, that is where we are going to find the influx of population from one town to another town, because the Chinese also have this thing where you go back to your family house for the eve of the New Year to have their meals. And so that is also a bit of concern. We have another function coming up on Tuesday, that is the 17th, which is called Taipusam, which is a Hindu thing. That is actually a chariot, a very big function in Kuala Lumpur and Penang. But the government has come up with restrictions that not more than 500 people will be allowed with the chariot procession. Not more than 50 people can gather at any one place. So they have come up with some restrictions and some guidelines. So we expect that to be okay. But our concern is the Lunar New Year, and we hope they don't come up with too many restrictions, because for the last 2 years, I think Dr. Chong and Dr. Alvin will vouch that they have not celebrated it with their families over the last 2 years, and I'm sure they're looking forward to celebrating it this year. So that is only the concern, but otherwise, I think we are quite well controlled, and I mean, things are going on smoothly, but there have been warnings by our Director General of Health that because of the Omicron, there will be a sudden influx of cases. We hope does not happen. Thank you.
Thanks, Ravi. Dr. Benito, do you want to update us on what's happening in the Philippines?
And I have some slides for you, Dr. Benito, so I'll share it with you. Yeah, go ahead.
Yes, these are the slides during the January 12th, comparing the surge of COVID-19. Again, the third surge in the Philippines. This is taken during the this January. That's NCR. NCR is the National Capital Region. We are experiencing the surge in the National Capital Region. As of now, we have yesterday we have more than 37,000 cases from December of 300 per day. And for the last 2 weeks, we have a total of 500,000 in 2 weeks, and totaling of almost 3 million since they started the COVID. Next slide. Then you can see here in this slide, is little blurred. This is the start in 2011 compared in 2022. The cases, there's increased cases of number of cases, almost 500 in 2 weeks. However, in the last portion of the slide on the right side, you can see that most of them were in asymptomatic and mild. There is a decreased number of cases of severe and critical. And our hospitals now are 50% full capacity, unlike before in the second surge last September, October, we have almost 100% capacity of our ICUs. Next slide. And most of the cases now are, this is the comparison between the Delta surge in 2021 in the September 5 to 18 compared the holiday surge in December 25 to January 7, 2022. Most of our cases during this year is incidental COVID, 87%, while those admitted to direct diagnosis of COVID is only 11.3%. Unlike before, the Delta surge, they are almost 50-50, 46% and 50% for COVID, 53.9% direct diagnosis for COVID. Next slide. Then, as you can see, in the ward, this is one of the Department of Health National Capital Region. More COVID-19 patients are being admitted are incidental. Like this table shows that admitted COVID, direct COVID diagnosis 226, while incidental admitted in the ward is 1,284. With mechanical ventilation, under ventilator is 8, while 16 for incidental COVID. These incidental COVID are for those surgery with other diagnoses. Next slide. And this is the new protocol regarding the testing and the period of asymptomatic close contact released yesterday. And we said that the fully vaccinated need to quarantine for 5 days from exposure and no testing. And while partial vaccination will have to stay at home for quarantine for 14 days, while healthcare workers fully vaccinated are required to 5 days quarantine and no more testing. Then regarding the quarantine period for asymptomatic and close contacts, we require them the 7 days for fully vaccinated, and the new guidelines is 5 days for fully vaccinated and 14 days for unvaccinated. For all you know, the Philippines had vaccinated about 52 million of our population, representing 47% of our population were being fully vaccinated. And this, as of now, we are vaccinating the remaining 12 to 18 years old, the A1, the healthcare workers, A2, the senior citizens, and we have to vaccinate about 1.5 million of our senior citizens and immunocompromised, while we are going to vaccinate the 5 to 11 years old this coming February. Next slide. Then this is the isolation for asymptomatic and mild, and the moderate to severe critical cases, fully vaccinated 10 days, severe cases for 21 days, as well as the healthcare workers fully vaccinated 10 days and positive severe cases for 21 days. Next slide. And these are the updated isolation period of all cases types in summary. Then these are our recommendation for our testing prioritization for clinical care. In the community, isolations are the same regardless of isolation. For A1, this is our aim is for surveillance plan to adequate health system, and they should be tested. Likewise, the A2, the senior citizens, the A3, the persons with comorbidities need to confirm the COVID-19 to know the investigate drugs that can be given, and they should be tested. However, for those with no symptoms for A1, A2, and A3, no symptoms, it is optional for them. They need to quarantine as much as possible immediately and monitor the symptoms. And all the with mild symptoms should be there should be optional for them to be tested with antigen or RT-PCR, and they need to isolate immediately in home care for teleconsult. Next slide. No more. That's our update. As of now, we have having many patients in our teleconsult, telemedicine, and we advise them to have at least a thermometer at home and pulse oximeter. And if their oxygen saturation is less than 94, there is that time that they must go to the hospital or consult their doctors. That's all.
Thank you, Dr. Benito. Dr. Chong, you want to go next? Dr. Chong, are you there?
Hello, Sarab. Everybody, good afternoon. This is Dr. Alvin Chan from Hong Kong.
Good afternoon, Dr. Alvin. Yeah, can you give a Hong Kong update?
So present, okay?
Yeah.
Thank you. I'm sorry that I could not join last week, and but just now I had enjoyed the presentation from the Philippines. Thank you very much, Dr. Benito. So I would be grateful if we can share the PowerPoints from the Philippines. Is that all right? Is that okay? Yeah, thank you. I think it's a very good presentation, and thank you. I appreciate it very much. And the management in the Philippines is really very good. And so, hello, Dr. Chong. Long time no see. I have been absent for 2 weeks. Sorry. So, in Hong Kong, we have been quite busy for these 2 weeks, just because of the Omicron, of course, and all because of the exemption of quarantine for our aircrew members in Hong Kong. You know, we leaked the Omicron into the community just because a few of those aircrew members exempted from quarantine had broken the rules and, flouted the regulations that they had left their home from quarantine to the market, to the places, restaurants, everywhere. The second day or the third day of landing, oh my God. So that's why in Hong Kong, we were very angry. The people had lost our right to have dinner outside in the restaurants in the evening now. And at first, we are optimistic that we could enjoy some family reunion, in the public in the New Year time, but now everything's gone. So we had to face a quiet Lunar New Year this year again. So anyway, so that's unfortunate. Although Hong Kong had marched into a good vaccination coverage stage now, we had overall, we already have 75% of our population having the first dose. Of course, much less than the Singapore, but then it still had a lot of improvement already. Even for the second dose, is already 70% of our population with second dose, and then, but then shamefully, we still have very low vaccination coverage in the elderly age group. So it's only 26% for those over 80 years of age. So this really too low, and it's too dangerous for us to really open the border. And so that's why we still have to follow the mainland policy as well for the zero tolerance. I would support this policy because our elderly population is just to feel with vaccination, and even for the 70 to 79 years of age group, is only 54%. Is far too low as well, and of course, and that below 69 years of age is already 70%. That's not too bad. Comparing to Israel, of course, I always like to compare to Israel because they are the first one to have achieved a lot for the vaccination, but then they also plateaued at the mark of 70%, and then. So that's quite unfortunate. I hope in Hong Kong we could march beyond the 75% vaccination coverage like now. But then we have to keep our finger crossed because there are quite a number of anti-vax people in Hong Kong. Many people are still very hesitant. And so I think we have to really have more campaign, and the government now has a policy of the vaccine passport. That is, unless you are vaccinated, you cannot go to the restaurants, cannot go to the gyms, cannot go to the bars, etc. Before the new measures. Of course, now in the new measures, everybody cannot go after all. So, but we are hopeful that these restrictions could be relaxed after the Chinese New Year if no more community spread. Now we, in fact, after the leakage of the Omicron into the community, now we only have one unknown origin. I mean, one case with unknown origin. All the others we could trace the chain of infection. So if we don't have any more cases of unknown origin, so we are hopeful that this Omicron wave is controlled. Then the policy could be relaxed again to relax the restrictions, and then perhaps open border with the mainland China, and then later on with other places. So we are just keeping our fingers crossed. Anyway, the deaths had not increased at all. It's still remaining at 203. That is the mortality rate kept at 1.8% for the 13,000 cases that we have. And so we because we don't have really any cases in the hospitals, so we don't have the experience of the treatment for COVID-19 in the hospital yet. Yeah, and that's the situation in Hong Kong. Thank you very much.
Thank you, Alvin. I will just update everyone about Singapore. So we've opened our borders, and we started these vaccination travel lanes with many countries. However, we just suspended the vaccination travel lanes for a few weeks until end of January, about 28th of January, pending the Omicron waves in many countries. So we just are being cautious. At the moment, we have something like 945 cases yesterday, of which 830 cases were Omicron, and close to 300 of them were imported, came from abroad. So, and there were about 540 local cases. Our ICU people in ICU is about 11, and 8 need oxygen, and about 185 are in hospital. So about 8 need oxygen and 11 in ICU. So there's some decoupling of the severity with Omicron. As far as vaccination is concerned, we've been rolling out vaccines in children 5 to 11 from December 27th, and we've covered about 123,000 children, which is about 40% of those eligible. So that's going on well. That's a first dose done. Tomorrow we'll start the second dose for some of them. And the other thing is we also have a statistic for children. We have 15,000, we have a total of close to 300,000 cases of COVID to date over the last 2 years. 15,500 were children. And of this 15,500 who were kids, about 1/5 of them were hospitalized. But I think very few in ICU and no deaths at all. So so far so good on that count. The total vaccine uptake, we stagnated at about 87% of the population, but now we've gone higher to 89% because of the school children, because of the kids 5 to 11 that have just started vaccination over the last 3 weeks. So we have pushed that number up to 89%, and I think 91% of the population now have received at least 1 dose. So 89 fully vaccinated, 89%, but 91% have the additional 2% are mainly the children who have received their first dose. So that's where we are at this point in time in Singapore. Anyone has any questions for anybody in the today?
Dr. Chong?
Yes, Alvin.
Dr. Chong. So for the children vaccination, you had now started the 5 to 11 years
Yes.
age group. So it's mainly Pfizer or also with Moderna or what?
Pfizer is authorized, and so far, from what I understand, I saw the latest data from the ministry. No severe side effects. I mean, no severe cases of side effects. So far, so good.
So for 1 month, or 1 month or 2 weeks experience.
This is the first dose. First dose we started on 27 December. About 123,000 children have been vaccinated with first dose. So tomorrow we'll start the second dose for them.
You mean 200,000 about?
123,000 have taken the vaccine.
123,000. So that's
Yes.
a big number already with no side effects yet. That's
Yes,
great.
so far, yeah, so far so good.
1/3 dose of the adult. Is that right?
Sorry?
Is it about
Yes.
1/3 of the adult dose?
Yes. Yes, it's a small dose. Yes, it's a small dose. I think it's 10. Am I right? It's 30, 10 or I forgot the number. 30, 10 or 30 microgram. Can't remember the exact number.
Yeah.
It's 1/3 the dose.
Yeah. In Hong Kong, we could not get hold of the Pfizer vaccine for the children. Yeah, so I mean, from Germany or from America, all gone to Singapore. Well, but then we give them. We have to give them Sinovac. Then we have to give them the Sinovac, and then later on, we will have our own off-label use of the adult vaccines diluting for 1/3 dose. I mean,
yes, yeah.
because they didn't give us the the children's dose.
The pediatric,
pediatric vial.
Packaging. Yeah.
Yeah. So we will use the adult formulation, but to dilute it up to 1/3 of the doses for children later on, off-label use. That's the way to go. So we give the choice for the parents. Otherwise, we don't have choice. Just the CoronaVac from Sinovac.
Our Sinovac and Sinopharm is not authorized below 18 here, so we can't
Yes, I
give it anywhere. Even if parents requested, we couldn't give the Sinovac or the Sinopharm because it's not authorized for below 18.
I see. Yeah, in Hong Kong, it's authorized to use it. I just like to ask, although so perhaps in the next few weeks, if you have the data, the incidence of any myocarditis after giving the 1/3 dose of in the boys. Really, we are interested to know that.
Yeah, I will keep you posted. And for the booster situation in Singapore, I forgot to tell you, everyone, we've reached 48% of the population. So 48% of the population have gotten boosters. Because of the Omicron, we're quite concerned. So we've been pushing the boosters. There's also a lot of what we call vaccine differentiated measures. That means starting 14th of February, a lot of people will be stopped from going into malls and so on and restaurants if they haven't received their booster. And to the extent that it even applies to workplace. That means if you haven't received your booster by a certain date, you are not allowed to go to work, and your boss may actually reserve the right to fire you. So it's quite severe. Our vaccine differentiation measures are quite severe.
Wow, then you can achieve 99.9% coverage then.
Thank you. Anything else for anyone? If not, I think we'll call the session to a close. And it was good to yes, Dr. Kazi.
Yeah, I mean, I want to take this opportunity to invite all our respected participants, especially the CMAAO members and all, that since the 2022 CMAAO meeting will be in Karachi. So we are working on that, and the dates are, please mark these dates, 23rd to 25th of September 2022, and hope that we'll have a better situation by then so that we can have in person and meeting there. And I would like to invite, on behalf of CMAAO and Pakistan Medical Association, to please be prepared, pack up for 23rd to 25th September for Karachi, and we would love to provide you hospitality and would love to welcome you all at Karachi in September. It will be a pleasant weather. It's a coastal city of Pakistan with a pleasant weather. So please be prepared and give us the opportunity to be host for the CMAAO meeting. So Chong, Alvin, Sharab, and I would especially like to tell our Indian friends that they can start working for their visa facilitation. We will be ready to provide whatever documents and facilitation we can do. So that's the first informal invitation, and the formal and official invitation will be sent once we get the approval and final program from our secretariat in Japan. So we have sent a few mails to our secretariat in Japan, and once it is approved, then we'll send you the official invitation. This is an informal, invitation, but mark those dates.
Dr. Kazi, Dr. Angelica has a message for you that please invite South Africa as well.
Oh yes, definitely. Akhtar is definitely, Akhtar and Angelica. Everybody. Yeah, sure. The Philippine, then Alvin, then Pillay. We would like to invite everybody, and this is an informal, friendly invitation. This is just the first announcement, unofficial announcement, so that you can mark the dates and start preparing for it, so that we'll have the council meeting, the General Assembly session, and we'll have joint the PMA scientific conference as well. So that we can have simultaneously these meetings and then some scientific program by the PMA as well.
Thank you. Dr. Chong, so let's call for the meeting. We already have exceeded the time. So thank you, everyone. And
we'll see you all next week at 4 p.m. right, Singapore time. And what's the time in the Indian time? 12:30.
1:30.
1:30. Yeah, 1:30. Okay. We'll
so
see you
Dr.
next
Qazi,
week.
we don't have like people from US and Brazil. I think we would like you to extend because they have been very important part for the meeting, Dr. Monica and Dr.
Definitely, Sharab. It's an open invitation because we've been listening to our US friends, Brazilians. Then Ravi, I'm really impressed by his presentations. So I'm in Malaysia, Philippines, Singapore, Hong Kong, everybody. It's an open invitation.
Thank you so much.
I may be missing some names, but definitely I think everybody should count them into it. And let's see you in Karachi in September 2020.
So thank you. With this
Thank
note,
you. Thank you very much.
We would like to close this meeting. This was the 93rd session and non-stop going every week. See you again next week. I will announce the change of the time for the next week meeting pretty soon. We may have an important guest, but the final confirmation will be done by today. And everybody will get an email or confirmation if there is a change in the time for the next week. Thank you so much.
Thank you.